This meeting is being recorded.
Okay. Welcome, and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. For the record, please note that Erin Kelly is representing the Deputy Mayor and Williams Isom, and Karen San Hilaire is representing Molly Wasso Park, all in a voting capacity. Let me move on to, according to Section 3B of the bylaws, functions, and powers, at each meeting of the board, the executive committee shall make a report of all actions taken by it since its last report to the board. Below are the actions taken at the May 25th, 2023 executive committee report. So number one was authorizing to extend its affiliation with State University of New York Health Science Center at Brooklyn, downstate, known as Downstate Health Sciences University, for services at NYC Health and Hospitals Kings County and NYC Health and Hospitals South Brooklyn Health through June 30th, 2026, for a total not to exceed $62,164,598, which includes a 10% contingency. Number two was amending the resolution adopted at the February 23rd, 2023 meeting to create an Article 43 subsidiary with a new name of MetroPlus Health Trio, Inc., and substituting the name MetroPlus Health Trio, Inc. The other one was approval. Number three is approval to appoint Frederick Covino, Carla Silverman, Salvatore Russo, and Valencia Lloyd as board members of the MetroPlus Health Trio, Inc., a subsidiary public benefit corporation to be established to hold a license under Article 43 of the New York Insurance Law. Number four is authorizing to execute an agreement with Broad Health Facilities Management, Inc. for biomedical program management for 8 years with two one-year renewal options for a total not to exceed $504,327,705. Number five was authorization to execute an agreement with Sodexo Inc. for laundry processing and linen distribution services for a term of 5 years with one-year renewal option for a not to exceed amount of $145,548,888. Number six is authorization to execute a contract with Health Resources Optimization, Inc. for coding denials management services for a 5-year term with a not to exceed amount of $6,820,780. Number seven is authorization to execute an agreement with Everytable PBC for retail food operations at Metropolitan for $107,723.63, Jacoby for $130,101, and South Brooklyn Health for $55,516.70 for a 5-year term. And then number eight, authorization to enter into a contract with Nalco Company LLC to provide water management services for a term of 3 years with two one-year renewal options for a not to exceed amount of $12,474,000. Number nine is authorization to execute a 5-year renewal license agreement with Williamsburg Housing Preservation LP for use and occupancy of approximately 1,742 rentable square feet of space located on the first floor at 333 Roebling Street in Brooklyn to operate a pediatric care clinic for an occupancy fee of $33,695. 10 is authorizing to further increase the funding by $1,960,238 for its previously executed agreement with Array Architects, Inc. for architectural/engineering services for the renovation of space at NYCH and H Bellevue Hospital, and the funding is increased from 16,887,169 to $18,847,407 to cover program management costs at Bellevue OTHU only. 11 is authorization to increase the funding for its agreement with ACOM USA Inc. to provide program management services at NYC Health and Hospitals Bellevue Hospital. Funding is increased from $15,136,567 to $16,635,305. I'm sorry, I read that again? Yeah. To cover program management costs at Bellevue OTHU only. Also, I read that twice. So. And authorization to increase the funding of its contract with Consigli Construction Company to serve as construction manager and builder for the system's correctional health services outposted therapeutic housing unit. 140,339,695, inclusive of 10% contingency approved by the board in May 2022, to $159,969,414 by adding $19,629,719. So now you know how I know how to read. So do any of the members have any questions or need further clarifications regarding these items? Okay, thank you. So let me then move on to the resolutions. I'm sorry. Okay, let me find them here. So next on the agenda is the adoption of the minutes for the executive committee meeting held on May 25th, 2023. Are there any questions, comments, or suggested changes? Can I hear a motion to accept the minutes?
So moved.
All in favor, please say yes.
Yes.
Opposed, say no. Okay, minutes accepted. So let me then move on to the resolutions. So the first one is item number 6 in your agenda. Dr. Calamia.
Thank you. Amended to extend the terms, this is authorizing the New York City Health and Hospitals Corporation, the system, to execute an agreement with Cardinal Health, Inc., Cardinal, for pharmaceutical distribution and patient assistance program services for the initial term of 5 years and 2 one-year options solely exercisable by the system in an amount not to exceed $2,708,915,965 for the entire contract term. It's presented to the Medical and Professional Affairs Committee, and again, this is the amended version to the full board.
Thank you.
Good afternoon, everyone. I will be going over the background and current state of this pharmacy distribution. New York City Health and Hospitals pharmaceutical wholesaler has been Cardinal Health, Inc., pharmaceutical prime vendor since 2011. We have had a relationship with the vendor as far back as 2004. Cardinal Health purchases all required drugs from pharmaceutical manufacturers, warehouses them, and sells them at the Health and Hospitals manufacturer negotiated contracted price. Cardinal Health distributes medications and supply orders daily to our 11 acute care facilities, 5 long-term care, 5 diagnostic and treatment centers, correctional health, and approximately 1,700 340B contract pharmacies. It is also common practice for all hospitals to utilize a drug distribution company for the receiving of pharmaceuticals. The existing contract was awarded to Cardinal Health with an initial 3-year term and 2 one-year options to renew. The board was informed of such contract on April 2018 President's Report, and no NTE was assigned. The annual current spend with Cardinal Health for pharmaceutical purchases is approximately $332 million. The contract with Cardinal Health expires on June 30th, 2023. For the background standardization, New York City Health and Hospitals has taken this request for proposal opportunity to standardize services for pharmaceutical distribution, patient assistance program, and Drug Supply Chain Security Act software, also known as DSCSA. In 2017, the board approved the award of a contract to McKesson Pharmacy Optimization, also McKesson RXO, which includes Pharmacy Patient Assistance Program for acute care facilities and DSCSA software services. The Patient Assistance Program allows New York City Health and Hospital patients who are uninsured or underinsured to qualify for a specific manufacturer program drug that would allow New York City Health and Hospitals to only be responsible for paying 15% of the contracted drug cost to McKesson. The patient assistance program, on average, saves New York City Health and Hospital approximately $23 million a year. The service cost is approximately $4 million a year. The DSCSA software is a subscription-based solution designed to support hospitals' compliance with the regulatory requirements of DSCSA. DSCSA software facilitates the monitoring and management of drug safety recalls by linking customer drug pedigrees with all active recalls admitted by the FDA and/or drug manufacturer. With the current McKesson RXO contract set to expire on June 30th of 2023, a 3 to 6 month contract extension is currently in progress to ensure a seamless vendor transition without disrupting patient care. For the request for proposal criteria, a minimum criteria of 10 years experience as pharmacy prime vendor. They must maintain full-time distribution center within New York tri-state area, must have $1 billion in annual pharmaceutical sales, and also must have experience in online ordering platform and interface capabilities with our EMR Epic, PeopleSoft, OmniCell, Century Split Billing, and Willow Outpatient Pharmacy Management Software Systems. The substantive criteria includes 30% of technological capability, 30% cost, 20% customer support, 15% resiliency, and 5% in references. The evaluation committee consisted of subject matter experts across the entire enterprise facilities. For key performance indicators are critical in measuring and evaluating vendor performance over the life of the entire contract. For our pharmacy wholesale distributor, the appropriate contract KPIs includes on-time daily deliveries at all locations within contracted delivery window, guaranteed fill rate and method of calculation information, product dating guidelines adherence, and ordering and reporting system uptime. For the supply diversity,
Thanks, Jeff. Keith Talby, Chief Procurement Counsel. The vendor diversity team reviewed all the potential scopes of work under the RFP, and they are the pharmacy distribution scopes of work, as well as the patient assistance program. Under the pharmacy distribution scopes of work, there are logistics, some services performed by the vendor to, do the professional services back of the house, as well as provision of the pharmaceuticals themselves, the goods. None of those fit within the program that we run. The logistics themselves are indirect spend. Our program, like many other municipal programs, only tracks direct spend. I will note, however, that Cardinal, with our assistance and in partnership, has identified and contracted with trucking companies that are MWBE, and they continue to look at additional opportunities there. The services themselves are 100% self-performed by Cardinal. They don't outsource those services or use any third parties. And the pharmaceuticals, there are no MWBEs that are also pharmaceutical manufacturers. For the Patients Assistance Program, it is mostly software with a small piece of professional services. Those are 100% self-performed by Cardinal, and again, are also indirect spend, so would not fit within the MWBE program. Accordingly, this solicitation was exempted from the MWBE program and has been historically. Because this is a large solicitation and we have, value concerns about our vendors and what their programs look like, we asked in the RFP about their ESG and diversity programs. Cardinal has had a supplier diversity program for 29 years. That's much more than other industries out there, really, just generally speaking, outside of healthcare and outside of pharmacy distributors. So I commend them for that. Those are metric-driven outcomes. They are part of the $1 Billion Roundtable. So they've done a good job there. And they also have a robust ESG program, which includes internal diversity goals, DE&I training, internal leadership and training programs, pay equity, community investment, donations, climate action targets, as well as waste reduction and recycling programs.
For the overview of the procurement process, timeline perspective, on August 16 of 2022, the CRC approved a request to issue the RFP for pharmaceutical distribution management services. On September 20 of 2022, the request for proposal posted on city records, sent directly to the 3 vendors. The three vendors includes AmerisourceBergen, Cardinal Health, and McKesson. They are the three vendors that dominate the market currently and meet the volume of New York City Health and Hospitals demand. On October 20th, 2022, the pre-proposal conference were held. The three vendors also attended. On December 16th of 2022, that was the proposal deadline, and we only received 2 proposals. On March 16th of 2023, the evaluation committee debriefed on the proposals. And then on March 29th of 2023, the evaluation committee completed scorings of the 2 proposals, and Cardinal Health was the highest rated proposer. For the vendor performance, Cardinal Health has historically been excellent at supporting New York City Health and Hospitals demand. Some examples include the COVID pandemic and also drug shortages. The performance overall quality rating has been excellent throughout the time. For the Board of Directors, request for approval amended to extend the terms, authorizing the New York City Health and Hospitals Corporation, the system, to execute an agreement with Cardinal Health, Inc. for pharmaceutical distribution and patient assistance program services for an initial term of 5 years with 2 one-year options solely exercisable by the system in an amount not to exceed $2,708,965 for the entire contract term.
Thank you. Any questions from board members?
Really quick.
Sally?
Who was the other vendor that's submitted? You said there were 2 vendors?
Yeah, that would have been AmerisourceBergen.
Okay, thank you.
Welcome.
Just following on that, do you know why the other declined?
It was the way they wanted to negotiate and keep the.
Yeah, we can speak to that.
Yeah.
I can speak to that a little bit. I think essentially the third vendor wasn't interested in participating in a very public process. They're used to a more private corporations process of conducting an RFP. And I think combine that with the competitive nature of the market, they chose not to participate.
I have a couple. Thank you. I think this is very clear. I just wanted to clarify because it's a very, very large headline number. And so I think it'd be helpful to explain how that, it's not Cardinal making $2.7 billion, right? I mean, they're not.
No, it's a distributor. It's kind of like when you go to a supermarket, right? The products on the shelves, it's not the supermarket. They buy it from the company. That's kind of what what Cardinal does. So we are in negotiations through group purchasing organizations. So we come up with numbers that this is our contracted price for a drug. Cardinal will carry that drug, and that's the price that we will get charged, minus any kind of agreements that we have, like distributions. They will cut down a little bit on the price because of the large distribution that they do. But the price of the drug is negotiated not through Cardinal, through other means.
And is it dependent upon the volume of drugs that we use, or?
Not with Cardinal. It would be with the manufacturer of the drug.
So in theory, if we needed to use a lot more drugs than we were anticipating, or that we have been historically, and we have to purchase a lot more, it would be at the contracted rate, and this contract then.
There's
would
no
go up.
limit. Yeah,
Right.
there's no limit to what the contract is.
Okay, so the 2.7 is sort of an estimate, not a,
It's based on historical spend.
right. Okay, and I wanted to ask a question, and I don't know if this is to you guys or maybe to Andy, about, there was a comment that the prior contracts don't appear to have been approved at the board. Is that right? It was just,
Kesson?
no, I'm sorry, the prior Cardinal contract.
Right.
Historically, the Cardinal contract was viewed as a goods contract since it really was primarily the purchase of things, meaning drugs, which under the board's policy does not need to come to the board. You don't see toilet paper purchases in the board, and so goods contracts hadn't been viewed as the Cardinal contract had been viewed as a goods contract. It does involve a little bit of services. There was a discussion with the board actually at that last round. And it was decided that because the numbers are so significant, it wouldn't come to the board for approval, but there would be a presentation and some notification about that. So that's what we did in 2018. And now I think with just further thinking and the fact that the relationship gets even more complex over the years, we decided that it was appropriate for it to come to the board this time around. So it's really just a change in sort of a discretionary decision and interpretation of what kind of contract this really is that's changed over time.
That makes sense. Thank you. Then, so I guess carrying on that, there seemed to be, I think if I'm understanding the presentation, the standardization that you're speaking of was that you had two vendors doing these different things, and now you're consolidating it all
Yes.
under Cardinal. So there are more services and other things involved, which sounds good. So my one question is that the savings that you're estimating here, about $23 million a year, that depends upon the service or the actions that Cardinal provides, right? Or is
That's
that
for
a
the
standard kind of just?
Yeah, that's for the patient assistance program. So that's just the delta between, what we would have paid for the drug for indigent and underinsured patients and what we actually had to pay. So that's what we
Due to the implementation of that patient assistance program, like you're able to get.
Yes.
You pay less because.
Yes, we pay
have the patient.
15% of what our negotiated cost would be.
Right,
Want to
and
just describe maybe like the retail level component of that, like the coupon rebate, how it, the eligibility, like how it works on the individual level
On the,
for Frida,
Yeah, so what would happen is at the retail end, if the patient is not eligible or does not have insurance and the physician prescribes the medication, we have people right now through McKesson who would go through this program, and it would actually reach out to the manufacturer. And they would get the medication from the manufacturer if the manufacturer partakes in this plan. Not every manufacturer does, but a lot of them do. So what they would do is they would supply the medication for the patient, and the fee for Cardinal or McKesson now would be 15% of whatever the cost would have been.
so you only have to pay 15% of the
Yes.
drug, right? And
And the drug company supplies it to the patient for free.
I see. And
Yes.
the performance of that provider, the McKesson or Cardinal, is important for us to get those savings.
Right. Yeah, so we have to indicate any patient who is uninsured or underinsured, and they have to get into the program so that they can then, McKesson or going in the future, Cardinal, can reach out to this program and get the patient enrolled and get the medication.
Okay, great. And so that's part of the KPIs and everything that you're tracking
absolutely.
in the contract. And
And I think that number will only go up.
terrific. Okay, thank you.
Okay, any other questions from board members? Okay, so let me ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Okay, it's approved. Thank you so much.
Thank you.
Thank you.
We have 4 resolutions 7 through 10 that I am gonna read them, and then I'll ask if you have any questions. You have the presentations and so on, but the staff is here to answer any questions you may have connected to them, so I'll go through them. So number 7 is authorizing New York City Health and Hospitals Corporation, the system, to enter into a license agreement with the Fire Department of the City of New York for the license of the staff house, which contains approximately 21,700 square feet of space, together with its grounds, the staff house, on the campus of NYC Health and Hospital Seaview, for a term of 40 years, provided that either party may terminate the license for its convenience on 30 days' notice, with the occupancy fee waived. And this was presented and approved at the Capital Committee on June 5th, 2023. So any questions on it?
Just very quickly, the $20 million that Kidney is supposed to secure to revitalize it, did they get it? If they didn't, is there a time frame by which they have to, or you're just flexible and you'll see when it, whether they're able to secure it? I know you don't.
Hi, Sally. FDNY is getting the money over a series of fiscal years to renovate the building.
Okay,
We believe they'll get it. They told us they're getting it, and they would like to take over the distressed asset, and we're happy to have them do it.
okay, thank you.
Thank you. Any other questions or comments? Okay, so let me then ask for a vote. All in favor of approving resolution 7, please say yes.
Yes.
Opposed, say no. So the resolution is approved. Thank you so much. So let me move to the next one. 8, authorizing New York City Health and Hospitals Corporation to sign a license agreement with the New York City Department of Parks and Recreation for parks to use approximately 13,000 square feet on the site of the former Neponset Hospital in the Rockaways for a lifeguard station for a term of 5 years with the occupancy fee waived and with each party having a right of termination for its convenience. And this was presented to the Capital Committee on June 5th, 2023, and approved by the Capital Committee then. Any questions on resolution 8? Okay, hearing none, then all in favor, please say yes.
Yes.
Opposed, say no. So the resolution is approved. Let me move to number 9, authorizing the New York City Health and Hospitals Corporation to execute a customer installation commitment with the New York Power Authority for an amount not to exceed $12,751,041, including an 11% construction contingency of $995,591 for the planning, design, procurement, construction management, and project management services necessary for the comprehensive energy efficiency upgrades at New York City Health and Hospitals McKinney. This was presented to the Capital Committee on June 5th, 2023. Any questions on resolution number 9?
Just quickly, we expect to save about $350,000 a year, is that right? Between electrical and gas reduction,
That is correct, yes.
so,
The-
yeah, it's not like a self-sustaining contract. The savings don't equal the expenses, the investment that you make. These are just savings that you'll be getting.
Correct. If you look at the simple payback, it's going to be over 40 years. That is correct.
Okay, thank you.
Okay, so then let me ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution passed. That was number 9. And number 10 is authorizing New York City Health and Hospitals Corporation to execute a design build contract with Fresh Meadow Mechanical Corporation to provide a boiler plant upgrade at Harlem Hospital over a term of 3 years with NYC Health and Hospitals for an amount not to exceed $36,594,712, including a funding contribution from New York City Department of Citywide Administrative Services, DCAS, in the amount of $13,782,718, with a 7% project contingency of $2,496,301. And this was presented to the Capital Committee on June 5th, 2023. Any questions or comments? Please.
I think we talked about this in Capital Committee, there's a bunch of benefits, cost savings, energy savings, emissions reductions. Will you be tracking that going forward, or this is an estimate from where you sit today? Is that something that you are able to track and kind of report on, or?
Once the project is completed, we should be able to track it, like do a measurement and verification on the project, yes.
Right, terrific. That's great to see. And then I think we also talked about this a bit, but this is the first time we're using design build in one of our own projects.
This is the first time that we're using design build where we're self-managing the project itself. We have used design build in the past via other means, whether NYPA did the work for us or DASNY did the work for us, but they've had their program already in place with contracts, with RFPs already templated out. This is the first time that we're embarking on this endeavor, and we have several other programs projects that we're going to be executing shortly.
Okay, great. And we talked a bit about the characteristics of projects that make sense for design build, and interested in hearing how this goes the first time around, and if you see the benefits of it, and
Yeah, I mean, there's supposed to be some great benefits, time savings, cost savings. We do have a reporting structure that we have to meet. We have to report back to City Hall and to the state once a year. Um,
about.
about the performance of the program.
Oh, good.
So
We've been interested to hear.
yeah, I mean, there should be a lot of benefits, but it's going to be a little bit tough going at first as we standardize everything. But it should be a win-win for health and hospitals.
Terrific. Thank you.
I think that's a good idea, and especially because we're talking about important upgrades to our facilities. Jackie?
Hi, what is the timeline on that?
The timeline to deliver the project?
Yes.
So I think it's going to take 3 years. I think it's on the slide. Yes. So the anticipated contract start date is September 1st, 2023, and anticipated contract completion date is August 30th, 2026.
Any other questions or comments? So hearing none, then I'll ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So thank you. Resolution number 10 approved. So on my report, I forgot to mention a few things, so I'll go through them quickly. During the executive session, the board received and approved oral and written governing body submissions from NYC H&H Jacoby, North Central Bronx, and Seaview Nursing and Rehabilitation Center. The board also received and approved semi-annual governing body reports. These are written submissions from NYC Health and Hospitals Lincoln, South Brooklyn Health, and McKinney Nursing and Rehabilitation Center. The board also received and approved semi-annual governing body 2022 performance improvement and evaluation plan, a written submission from NYC Health and Hospitals Guernier and Morrisania Gotham Center. And then I would also like to thank Sally Hernandez Piñero for participating in the Plane 3 survey at Jacoby and Kings County. Ms. Hernandez Piñero and also Ms. Rowe Adams also visited the Carter facility, so thank you to you both. So let me move on to Vendex approvals. Since we began the process of approving contracts prior to Vendex approvals, there are 2 items on today's agenda requiring Vendex approval. Both have that approval. There are 3 items from previous board meetings pending Vendex approval. Since we last met, no approvals were received. And let me then move on to President's report for Katz.
Oh, very good. Thank you, Mr. Chair. We are very proud, and I hope the board is too, about NYC Health and Hospitals' role in the humanitarian emergency response and relief centers for asylum seekers. We've opened up 3 new centers in the last month. We currently are providing care to 12,000 people in the centers, and we've cared for more than 20,000, which means that we've helped 8,000 to resettle and go on to another place that's more permanent. We've administered over 15,000 vaccinations to kids. We've enrolled 12,000 people into health insurance, and now we run at Roosevelt Center, the city's first centralized arrival center, so that we can keep track of all of the people who have come to New York City seeking asylum. Through our partners at the Office of Labor Relations, we've reached agreement on 2 major collective bargaining agreements in recent months involving our employees, District Council 37 and Teamsters 237, and we are very much in negotiations currently with NYSNA. A evaluation of our care of HIV patients showed that we had very high success in connecting new members to primary care and specialty care, and that the high engagement was especially true among those who had 2 or more chronic diseases and spoke English as a second language, which I think really is testimony to our ability to engage undocumented and low-income New Yorkers who don't have access to health insurance regardless of language barriers or burden of disease. 3 of our Gotham centers received the highest level patient-centered medical home designation for our work to improve patient health outcomes and patient satisfaction. The teams at Gotham Health Bushwick and Greenpoint in Brooklyn and Gotham Health Gun Hill in the Bronx earned the National Committee for Quality Assurance 2023 recognition. We were very active in support of President Biden's initiative to make sure that new parents have appropriate postpartum coverage after their birth. We delighted in the celebration of Pride, especially that 5 of our doctors were chosen by Castle Connolly top LGBTQ positive doctors, Dr. Almond, Dr. Green, Dr. Kemeny, Dr. Pitts, and Dr. Siegel. We celebrated Juneteenth in a variety of ways, recognizing the importance of the day to our whole system. And we used it to reflect on the history of the state, our hopes, our mission, and that we would celebrate Black communities having freedom from all healthcare disparities. We've received $1 million in debt relief funds for our behavioral health providers. We think that loan repayment is a great way to increase workforce because it not only gives people an incentive to stay with us, but it attracts people with larger debts who likely started from a more economic need perspective, much like our own patients. So we think it's a particularly good way of attracting providers who look and are from the same backgrounds as our patients. We kicked off a new season of paint parties with community murals, which I think is such a great idea of making the community part of the art itself. Art isn't just something that hangs on the wall, although we have some beautiful pieces in this room, but it's also something that people can make and feel a greater sense of pride in their facility. We are working with community partners, hosting their farmers markets. We feel it's a great way to make it easy for our staff, patients, and members of the community to access fresh local fruits and vegetables at an affordable price. The American Essential Hospitals, which represents more than 300 hospitals that care for low-income people, this month awarded Health and Hospitals a 2023 Gage Quality Award honorable mention for our Care Improvement Contest initiative. Our team was recognized at the AHA's annual Vital Conference for activities that improve the quality of care or that mitigate threats to patient safety. Our health system graduated the second cohort Quality Academy participants for the 6-month multidisciplinary quality and safety capacity building program. There were 142 graduates, and I know those members of the board who participate in our Friday QI meetings have seen some of the great work produced by the graduates of this program. A lot going on in community affairs. I'm not going to read all of it, but the city just finalized its budget, and we thank the speaker, the hospital and health chairs, and all the city council champions for their support, and the mayor for signing the new budget. The state concluded its 2023 legislative session. Earlier today, I was with Human Services Secretary Javier Becerra for a tour of Metropolitan. We wanted him to see the emergency department and see that we very much need a new emergency room that would be larger and better able to deal with the volume that we have, and we're joined by the congressman as well from that district. We hosted an educational conference for our community advisory board on June 23rd, focusing on how to run meetings more efficiently and effectively, and we're always very grateful to the CAB members who do so much to support us. That's my report, Mr. Chair.
Thank you, Dr. Katz. Any questions from board members?
Question, I think at the state level, legislation was passed by the assembly that would have insured undocumented workers and hadn't passed the Senate. Did that just stall? There was supposed to
It
be
still
federal
has
funding.
not passed.
Still has not passed.
Any other comments or questions? Okay, well, thank you, Dr. Katz.
Thank you.
So, committee and subsidiary reports, the committee reports were emailed to you and are in your folders for your review and submission into the record. Is there any old or new business to come before this board? None, the board meeting is adjourned. Thank you so much.
Record time.
Good time.
This meeting is no longer being